Welcome to Methodist Hospital. Today we will demonstrate how to get out of the bed and getting back in bed after hip or knee replacement. We can teach you to get in and out of bed on either side, but it is often easier to get in and out of bed at the same side of your operated leg. Sit yourself up by pushing up your arms behind you. This will avoid bending your hip past 90 degrees. Slide yourself to the edge of the bed by using the combination of your arm strength and your unoperated leg. Bending of your unoperated leg and pushing on your heel will help you move over in the bed. As you are shifting, keep your legs apart and your knee cap pointing in the ceiling. Slowly move your leg out of the bed and gradually coming into sitting position with your arms providing support behind you. As you stand, push up both hands from the bed and slowly try to stand up. Make sure standing up straight and don't lean forward at the waist. Continue to focus on being upright once you're standing. Push the walker forward, move the bad leg forward, push down on your arm followed by moving your good leg. Slowly turn, make baby steps and follow the same procedure. Slowly go backward using your good leg first, followed by bad leg till your knees touches the chair. Keep the bad leg forward. Reach back for the chair with your arms and sit down slowly to complete the transfer. Gait training after hip or knee replacement. Assuming the operated leg is the left leg. Push the walker forward, followed by moving the operated leg forward. Transfer your weight to your arms by pushing through the walker and move the unoperated leg. Push the walker forward, followed by operated leg forward, transferring your weight down to the walker through your arms and move your unoperated leg. Continue the process. Stair climbing activity after hip or knee replacement. Two principles to follow. You go up with your good leg first and you go down with your bad leg first. Up with the good, slide, up with the good, slide your arms, up with the good, slide your arms, up with the good. When you get to the top, slowly turn towards the unoperated or operated leg, making baby steps. Going down the stairs, slide your arms forward, go down with the bad, transfer your weight to your arms, and then your good leg. Slide your arms, go down with the bad leg, transfer your weight to your arms, and then the good leg. Slide your arms, go down with the bad leg, transfer your weight to your arms, then the good leg, go down with the bad leg, and good leg. Keep straight up. How to get into bed after hip or knee replacement. Back up towards the bed using unoperated leg first, followed by operated leg and pull the walker last. Keep doing the same process till you feel the edge of the bed or chair with the back of your legs. Move your operated leg forward. Reach back for the bed with your arms and gradually sit down. Once seated, put your hands behind you, pushing with your unoperated leg and using your arm strength. Scoot yourself backwards towards the center of the bed. Move yourself toward the pillow using combination of your arm strength and unoperated leg. Bringing both legs up into the bed. Position yourself straight in the bed and keep your both legs apart all the time, using a pillow as a reminder.